want to share a story that I think a lot of you can relate to. As a young, fresh physical therapy student, we can dive into a whole course on manual muscle testing. And it becomes pretty apparent after 2 or 3 sessions, and we start looking around the room when we're being taught this grading system of 3 to 3 plus to 4 minus to 4 to 4 plus to 5. And we look around at everybody else in the room. The first question that everybody comes up with is, well, professor, how does my 4 plus compare to his 4 plus versus her 4 plus? How are we grading these things? And I think even as uninitiated clinicians that haven't practiced in the real world, it's pretty apparent that these tests, maybe aren't the best. Hi, my name is Jacob. I'm the owner of Peak Force Systems, and I'm going to give you a quick little preview of why we think manual muscle tests suck. So originally, we need to look back at the initiation of manual muscle tests, and they were originally created for more of a neurological population. So think about big weakness issues like stroke is kind of the classic example. So this setup was really determined to try to get a sense of how strong, or strong's probably not the right word, how weak these people really are, and to what extent are they having motor deficits based on their significant neurological injury. And, certainly in a population that has profound motor deficits, the MMT can be a useful screening test. We certainly advocate, we think that the word screen is probably a better way to describe a manual muscle test, and it's probably not best to describe it as a specific test. We have seen in numerous studies that compare MMT versus handheld dynamometer that you need really massive differences in force output to be able to determine a difference in your manual muscle test grade. So in the shoulders, the difference is like 40%, and we've seen that in a number of different studies repeated. So really, if you notice a difference in grade between your manual muscle test, probably you have a pretty massive difference in the actual number of force that they can produce if you actually measure it. And then, certainly as we move our way up, away from less force generating capacity muscles or movements into things that create more force that are stronger, we're going to be quickly overpowered as clinicians with our hands. The classic example here is trying to test knee extension strength or quad strength after a knee injury, or especially an ACL. The force generating capacity of these type of muscles, namely your quads, your glutes, your plantar flexors, are just going to be way, way, way too high to be able to resist with your hands and get any meaningful data. So that's why we are banging the drum on test, don't guess. A whole goal of Peak Force is the reason we started this is to try to create more accessible objective strength testing. We find that our products are simple, effective, and affordable, and we are trying to get these things out into the clinics, into the community more, so that clinicians can get better information for their clients and their patients to improve outcomes. Thanks for watching. Definitely check out more of our educational content on our Instagram at Peak Force Systems, and then also check out our website at peakforcesystems.com.